Hi, I'm Keith Ward. I'm the CEO of Kuria Therapeutics, where we leverage mitochondrial biology to power sight. Our core therapeutic hypothesis at Curia is that mitochondrial dysfunction is a root cause of multiple blinding diseases. To give a little background on this, of course, we're all taught that the mitochondria are the power plant of the cell, producing ATP to drive cellular processes. What's often less well understood is that in the course of producing ATP, mitochondria also produce waste products. These come in the form of reactive oxygen species, or ROS. And the cell must undergo a constant balancing act between production of energy and managing these waste products. The cells develop elaborate processes for doing that. But in the face of excessive ROS, whether that's as a result of energy production or external insult or a disease process, the mitochondria have to tap the brake on energy production while they catch up on detoxifying ROS. And it's an imbalance in this process that then drives many chronic diseases of aging that we believe drive visual dysfunction. This is no more important than in the eye because, of course, the eye carries a very high energy demand. In the retina, ATP is required to drive the visual cycle in the RPE and the photoreceptors, the neuroretina. In the cornea, ATP is used constantly to keep the cornea clear as it pumps water out of the cornea. And of course, the eye is exposed constantly to oxidative insult, whether that's because of high oxygen tension in the choriocapillaris or the literal every time you open your eyes facing UV insult from the external environment. Therefore, we believe that mitochondrial dysfunction is a root cause of these multiple ophthalmic conditions. And this has been well established in the literature, whether that's in retinal disease, the diseases of the neural retina, or in corneal dysfunction. At Curia, we work in the biology then of a product called NRF2, and activating NRF2 serves as a master regulator of mitochondrial function and detoxification of oxidative stress and ROS, and we believe will lead to improvements in vision. We're not alone in this belief. In fact, there are over 700 papers that support the role of NRF2 and the eye. NRF2 has been well established to increase ATP synthesis, to drive new mitochondrial formation, and literally to power the processes of sight. But its probably better known function is as the master regulator of the antioxidant response. Activating NRF2 restores redox balance to the cell by production of dozens of proteins that manage ROS. NRF2 activation reduces NF-kappa B-driven inflammation and helps resolve fibrotic processes, all of which are important in various ophthalmic conditions. And activating NRF2 clears mitochondrial waste products. At Curia, we're developing what we believe to be best-in-class ophthalmic-focused NRF2 activators, and our lead agent is called SCO-116. Our lead is an advanced agent. We've demonstrated potent selective NRF2 activation in multiple animal tissues, including the eye, and have developed clinic-ready formulations. We have good patent coverage on this lead agent. It's been well tolerated in both in vitro settings as well as in vivo, both systemically and in the eye. It's efficacious, and I'll show you some of the efficacy data in the eye in a bit. We also have data in systemic models for reduction of fibrosis in, for example, liver and kidney. And the agent is ready to move into GLP toxicology studies with a direct to phase 2 path in a very short time frame. Our initial clinical indications of interest cover both the cornea and the retina. In the cornea, we're interested in treating patients with Fuchs dystrophy, as well as protecting the corneal endothelium in patients undergoing cataract surgery. And in the retina, we're focused on dry AMD. As you know, recently there have been advances in the availability of dry AMD therapeutics. For years, an antioxidant was the only available therapy in the form of an arid supplement. But new medications certainly have been shown to decrease the rate of progression of geographic atrophy, although unfortunately, those have not yet translated to improvements in vision in patients with dry AMD. We believe activating NRF2 early in the disease process has the opportunity to improve visual acuity in patients with dry AMD and thereby meet a high unmet medical need. As I mentioned, our agent has been shown to activate our target protein, NRF2, across multiple ocular tissues, whether those are in the anterior segment or the posterior segment, and whether given by intravitreal injection or by a topical drop. This translates in cellular models to an improvement in mitochondrial function, as you would expect from the biology of NRF2. We've shown a 5 to 10% improvement in ATP production and in baseline oxygen consumption in healthy cells. This is a very large magnitude improvement in healthy cells, similar to that observed with marketed NRF2 activators, such as Skyclarys, which is approved for a rare neurologic condition. Importantly, we do so with excellent potency, in this case at concentrations as low as 0.3 nanomolar. This translates to in vitro efficacy. We have demonstrated efficacy in a model of RPE cells insulted with A2E and blue light. This produces a decrease in the number of viable cells, an increase in apoptosis and dead cells, and we're able to show complete protection from these effects with low nanomolar concentrations of SCO-116. And this is translated to efficacy in gold standard in vivo models of ocular disease, in this case, a sodium iodate model in rats, whereby we pretreat with SCO-116 and then give a subretinal injection of sodium iodate. That leads to visual acuity deficits and decreases in contrast sensitivity, as well as retinal thinning. And as you can see, we were able to significantly protect from all of those negative effects in the presence of SCO-116. Of course, we have a broad interest in ophthalmology. We believe that application of this biology can be effective in a number of retinal diseases, as well as glaucoma and corneal conditions, as I mentioned. We're excited to be presenting the company to you today. Please visit us on the web or feel free to reach out if you have any questions. Thank you.